Adults that care for young children in a primary role have first-hand clues into what change might tell us about children. Think about the change and early loss children may face.
Change is the only really permanent thing in our life. And when you talk about change in young children, the kinds of losses that young children experience are primarily the early losses that they have is sometimes just moving away from their home. Sometimes young families are changing homes in early life. One of the other losses that some children experience is separation of parents or divorce. Sometimes it's the loss of a pet. A pet may die. And unfortunately, about 1 in 20 children experience the loss of a parent before they graduate from high school.
Change can often be positive for children, but can also disrupt children's equilibrium and trigger behavior we don't understand.
I think one of the things is to think about your children in your room and think about the changes that are going on in each of their lives. Many of them are very positive changes. They're growing, they're reaching milestones. But think in particular about the children who you may have some behavioral issues in the classroom. And one of the first things I look at in my assessment process is I look at are there any family issues? The last thing I do is make a referral. The first thing I do is talk and see what's going on within the family. There may be a sick grandparent, an extended family member. There may be a change of job in the family. There may be unemployment in the family. These are all losses that disrupt the equilibrium of the child's life. And in and of themselves are enough to trigger behavior that we don't understand. And I look there first, because change is the only permanent part of human life, is that things change. It might be the birth of a new baby. So while it's a big gain, it's a loss for the child. They change their position in the family. They go from being the only child to being the firstborn and being the oldest.
Think about how you might connect with a child going through any type of change, from expected changes, such as getting dressed, or unexpected changes, such as a family move or a deployment or even a death.
And if they lose a parent, very often the kinds of losses we have in this environment first is the loss of a grandparent. But because young children, they have very little life experience, their coping mechanisms are very fragile. They have limited use of language. Their ability to understand the permanence of death is very elusive because they don't understand time. And so it's really important, I always emphasize to parents and to the staff, is that we connect with a child that's going through any kind of change. From the changes I described a few minutes ago to the permanence of the death of somebody that they've loved.
As we observe children experiencing change, we can become better prepared to identify their needs and respond.
We know from research that within the first 24 hours of life, a child knows their mother's voice from all other voices. Any human that has the capacity to love, and a child has that at 24 hours, has the capacity to grieve. They may not have language, but the feelings associated with the separation are there. And a child will become irritable, they'll become tearful. They're just difficult to settle. Maybe sleep patterns will be disturbed, eating patterns will be disturbed. And we see this all through the early years of life. And they just don't have the verbal skills to say what's happening. And that's why I feel like it's so critical that we connect deeply with the children that we know and love and get down to their level with eye contact and just say, I know that something very sad happened. I think one of the most important things when a child is grieving, and I think that research and child development specialists like pediatricians and child psychiatrists and psychologists is to maintain a child's routine as much as possible.
Children learn primarily through their senses and build understanding on experiences they have had in the past. Therefore, healing and comfort come from what children know.
Children learn primarily at this age because they don't have language and they certainly don't have reading skills. All their learning comes through their senses. So how they know things is what they've seen, what they've touched, what they've tasted, what they smell. That's how they know. So when you bring things to them through their senses, that's where the healing comes.
Visit Better Kid Care. www.betterkidcare.psu.edu. We care because you care.